Hello everybody, I'm Dr. Eric. Here we are at the San Francisco School of Massage. This is Katie, and we're going to demonstrate a little bit about what's coming up in the trigger point class that'll be happening real soon. So we're going to show a psoas release move, all right, or two, we'll see. To find the psoas, it's really helpful to find the hip point, the ASIS, the anterior superior iliac spine, and we're going to go just medial to it and maybe slightly superior. It's a good starting point. To make the palpation a little bit easier, I'm going to have Katie bend her knee so that we can sink gently, soften the ab muscle so we can sink gently in through the different layers of tissue. And I'm kind of moving the viscera gently out of the way. And as I do, I'm starting to feel underneath it for fibers of the psoas muscle. And sure enough, one of them starts to present itself. It's a little bit more medial, so I'm going to roll in. And just to make sure I'm on it, I'm going to say, Katie, go ahead and pull your knee up towards your chest a little. Oh, and as soon as she does, I feel it jump right into my hand, so I know I'm in the right place. Now, I'm just going to gently palpate up and down those fibers until I feel a little contracted area, and I'm going to zero in on it. Now, I'm going to add a little pressure, and I'm going to use a trigger point tool that we call the compass, where we're going to go north, south, east, or west to figure out exactly what vector to put our pressure in. So if I go north, I feel like it's not that interesting, and Katie's like, nah, not so good. If I move south, it feels like, whoa, there's more tension, more tenderness there. I feel it's much more responsive. Let's try going east, and again, I kind of lose it. Not that interesting. Let's try going west, maybe south and west together, and we're getting closer, right? So here, I add those two vectors and I feel, oh, I'm really able to pin that trigger point now against the inside of her pelvic bowl. I'm gonna sink in and add pressure with that exact vector, and often at this point you'll feel some breath come in, a little bit of tissue response. I'm just feeling for that melting and that opening, and when I do, I'm going to slowly have Katie stretch her legs straight, and as she does, I'm going to pin that muscle and have her take it through a gentle range of motion as we release it. So that's one way to do it. Another way is go ahead and bend your knee up, hold it there. I'm actually going to swing around the other side, and this time I'm going to use my thumb. I'm going to find that same exact spot where we were. I'm going to keep my thumb lined up so my body mechanics are good. And here, I'm going to do the shortening work myself. I'm just going to get her into a nice soft place and then pin that exact same trigger point, north, south, east, west. I'm kind of liking the same vector, south and west a little bit. And then in this position, I can really play, right about there. And I'm going to pin that trigger point, and I'm going to wait 10, 15, 30 seconds maybe for it to really release. There it goes nicely. And then once again, I'm going to hold it while Katie straightens her leg and really takes it through a stretch. And then we just go in there, we make a little nice, shake it out a little bit, and that's the kind of thing we're going to be doing in the trigger point class in all the different regions of the body. Really fun, extremely effective therapeutic tool. Hope to see you there.